motion is life. As long as a human being is mobile, he can lead a normal life. He can enjoy life to the fullest. However, if due to any ailment his movement is restricted, a number of associated problems are bound to crop up. He becomes dependent on others for his needs. Such a situation can be avoided if our body is healthy and mobile. The human body is indeed a brilliantly engineered marvel of nature. The various body parts function in unison to help achieve unfathomable heights. The human skeleton plays a vital role in the human body. The entire skeleton comprises 206 bones. They provide support and structural framework for the body, simultaneously protecting the internal organs. Besides the bones in our body, the joints play a vital role in facilitating daily activities of life. The meeting point of two or more bones is called a joint. Joints help us do our everyday tasks well.
All our daily activities like eating, drinking, praying, all need our joint activities. For example, the limb, if I have to bring something from here to my mouth, it has to move somewhere. Otherwise, I can never bring it to my mouth. It has to come like this. So there are multiple joints, shoulder, elbow, wrist, joints of the finger. So you can see it. For example, there is this model. There is one bone there and one bone there, and these are the two bones which are connected at the joint. This joint has to work. You see, it's smooth and it is painless in human body because the bone ends are covered by cartilage, which is painless structure. Without painless joints, we cannot do any daily activity of our life.
As long as our joints function normally, all is well. We are able to accomplish the everyday tasks well. Sometimes, however, we begin to face certain problems. For instance, our knees start to ache.
When we talk of joint problems, we are basically talking about joints which are carrying the weight of the body. By which I mean the hip joint, the knee joint and the ankle joint. Major problems they arise in the knee joint.
In a normal joint, there is a smooth covering of cartilage, which is painless structure. There is no nerve supply in the cartilage. So anything going wrong with the cartilage will cause roughness in the joint. The causes, most common is trauma, injury. That can be a fall, that can be a sports injury or a road traffic accident. Whichever damages the cartilage or any intra-articular fracture, that causes pain. Second is any damage to the cartilage other from trauma. For example, because of age, what we call degenerative arthritis. In common language, we know it by osteoarthritis.
Arthritis is that stage of joint problem where the cartilage between two joints, due to any disease or an accident, gets inflamed, damaged, or becomes rough. Subsequently, there is pain due to the rubbing of the two bones.
Arthritis is a very commonly used term, and many times it is very vague. Patients generally don't know what is arthritis and what is synovitis. Joint is surrounded by a capsule which is lined by a thin membrane which is known as synovium. The inflammation of synovium is synovitis. That is the first stage of any joint disease. Second stage is this cartilage, the bone end is covered by a smooth cartilage. Whenever, because of any reason, whether it's trauma or it's inflammation or whatever, if this cartilage is damaged and its smoothness is disturbed, that is known as arthritis.
Main problem which we face as orthopedic surgeons is the arthritis of the knee joint, predominantly. And arthritis can be of any variety. It can be degenerative osteoarthritis, it can be rheumatoid osteoarthritis, it can be psoriatic osteoarthritis, it can be post-traumatic osteoarthritis, it can be gouty arthritis, a wide variety of arthritis.
There are many causes of arthritis. Arthritis sets in due to advancing age. It is important that we do regular exercises, reduce weight, and keep it under control. Our diet should be appropriate. Ailments like diabetes, hypertension, or coronary diseases should be treated properly.
Any person who has got osteoarthritis of the knee joint, if he or she does regular quadriceps exercises for an hour a day, I can assure you almost 80 to 90% of the patients will be free of pain.
If somebody is suffering from inflammatory arthritis, at an early stage he can be treated with medicines, and even surgery is not required. The third cause is trauma, which is caused by an injury or accident.
Nowadays, with these high-speed vehicular accidents and fast-moving life, we are seeing a lot of fractures we previously never used to see. Multiple fractures, multiple bone injuries, and serious patients. We have got a very well-equipped casualty. We have got our own orthopedic registrars who look after the patients as soon as they come to the hospital. They are immediately attended to. So in that way, we have got a very well-equipped machinery here as far as the Department of Orthopedics is concerned.
The joint problems can be treated successfully through surgical interventions. Most of the time, people are afraid of surgery, but now there is no reason to fear. The medical science has advanced so much that these days surgeries have a high success rate. The joint surgeries have become a routine affair now. Knee joint replacement surgery is also commonly called as knee replacement. When to go in for knee replacement? When the pain demands more than 3 painkiller tablets per week. When knees pain even at rest. When knees pain at night. When you are unable to perform your daily activities due to knee pain.
Basically, for any joint replacement surgery, what you need, there are a few factors. One is an excellent OT, which should be available to the surgeon to operate. Number 2 is trained orthopedic surgeons to do this surgery. Number 3 is a good physiotherapy department which will look after the patient post-operatively.
Shri Balaji Action Medical Institute has the best world-class facilities for knee replacement surgeries. Expert and renowned surgeons in this field and a team of efficient doctors are performing successful knee surgeries using the state-of-the-art equipments, as a result of which many patients are benefiting from it every day.
बुरी तरह था मेरे ये घुटने में दर्द, चल नहीं पा रही थी. उसके बाद मैंने यहाँ हॉस्पिटल में आई, इन्होंने मेरे घुटने का ऑपरेशन किया. अब मैं ठीक से चल लेती हूँ, बहुत अच्छा है.
जनरल में आई मोर देन नॉर्मल, जैसे 15-20 साल पहले चलते थे वैसे है चलना. तो
We are not doing joint replacements by traditional techniques, because in that technique there was long incision, damaging of tissues, and the recovery was very slow. We are doing knee replacement by MIS technique, that is minimal invasive surgery technique.
At Shri Balaji Action Medical Institute, knee replacement is done using the MIS technique. MIS means minimal invasive surgery. This is a very dependable and a safe technique. In North India, this technique is available at very few places. In everyday language, it is also called as small incision surgery. This is a very easy surgery, and the patient can get it done anytime successfully at Shri Balaji Action Medical Institute. Within a week after the surgery, the patient is able to resume his everyday tasks.
The left knee replacement was done somewhere else 7 years ago, and this surgery was done by us about 2 months ago. In this patient, you can see the incision length is around 12 inches in a conventional surgery, but in MIS surgery, it's around 6 inches or less. That means almost half. The difference is not just cosmetic, that the incision less, because for this patient, there is no significance of skin cosmesis. The importance is that this patient was not able to walk for 3 weeks after conventional surgery. But now, with MIS technique, he was able to walk within 3 days.
अब मेरे घुटनों में किसी किस्म का कोई भी दर्द नहीं है और चलने में बिल्कुल आसानी है. खूब चलता हूं मैं.
herein the orthopedicians, they are very much trained. They put those kind of implants which last for life, and also my patient gets mobilized within 3 days. You can see the patient walking in the corridor within 3 days, and within 1 week he goes back home. This is the most important thing. A patient who cannot walk, that's why he has come for the knee replacement, and now he's walking on his feet for in a week's time. So that definitely gives the confidence. And also we have dedicated a separate area for joint replacement unit, so that there is no risk of infection.
My message to arthritis patients who are considering knee replacement is that they should know, they should meet these patients, they should know about this technique, that this is not a big deal surgery now. It can be done on routine basis. We have all the facilities, all the backup, and they should avail this facility at Balaji Hospital.
सर्जरी में एक तो पेन खत्म हो गई बिल्कुल, और चलने में काफ़ी आसानी हो गई.
बालाजी का मेरा बहुत अच्छा एक्सपीरियंस है. इनका ट्रीटमेंट पता नहीं क्या मैजिक था इनके हाथों में. मेरे टिपिकल फ्रैक्चर होने के बाद भी इन्होंने बोन्स को मतलब किसी तरीके से एडजस्ट करके प्लेट लगा के इसको ठीक किया.
Like the knees, many problems can crop up in a person's hip.
And there are few arthritis which are very joint specific. For example, in hip joint, we have a condition known as AVN, that is avascular necrosis of the hip. This is the femur, this is neck, and this is head. This head fits into the acetabulum, and that makes the hip joint. The blood supply, the nutrition of the head comes through the neck, through the blood vessels in the neck. Because of certain reasons, for example, smoking or alcohol, this blood supply is blocked, and that leads to softening of this head. It becomes very soft, and when talking, this becomes compressed, and the articular cartilage, which is generally smooth and shining, it becomes crumpled, and that leads to arthritis. There is another condition in young patients known as ankylosing spondylitis, in which the spine is involved and even the hips are involved. So that is again a disease of young males who are in their 20s, 25, 28. Unfortunately, their spine is become what we call as bamboo spine, and both the hips are also involved, and they need hip replacement in very early stage.
Some people have congenital hip anomalies. Some suffer from infections that cause defects in the hip. Due to gout or diminished blood flow in the hip, hips are damaged. An injury can lead to hip problems. Advancing of age can also cause hip problems. Old age fractures can compound this problem further.
The most common problem of hip is a fracture. Hip fracture being one of the most commonest, it's either a fracture neck of the femur or it is a trochanteric fracture. Now there's a slight difference in both the fractures. The treatment in both the cases is surgical. In fracture neck of the femur, we replace the hip joint, and in intertrochanteric fractures, we fix the hip joint. Now fixation, when I was talking of minimal invasive, fixation nowadays we are doing with minimally invasive surgery, hardly 2 stitches, and we fix up the fractures. And previously patients used to take almost 2 weeks, 3 weeks to stand. Nowadays we make the patient stand and walk the day after surgery.
In case of hip pain, a specialist doctor should be consulted immediately. If he advises surgery, it should be done at once.
Hip replacement, we are in a better position as compared to knee replacement, because patients' acceptability and confidence level regarding the hip replacement is very high. Another favorable factor in hip is that there is a very thick muscle cover and very good blood supply in the joint. So the healing is very fast. Another thing is that the implants, the quality of implants and the variety of implants, they are much better. We have a wider choice in hip replacement.
मेरे जो कमर में दर्द हो रहा था हिप में, तो मैंने बालाजी हॉस्पिटल में एडमिट हुआ और यहाँ पे मैंने ट्रीटमेंट करवाया. अब मैं पूरी तरह से फिट हूँ. मुझे किसी तरह का पेन नहीं होता है और मैं नॉर्मली चल रहा हूँ. सब कुछ कोई दिक्कत नहीं है मुझे.
Our general instructions after a hip replacement to a patient is that you are not allowed to use Indian toilet, you are not allowed to sit on the ground, you are not allowed to sit cross-legged, which are very vital things, which are very vital activities as far as Indian culture is concerned. So now we have implants in which patient can squat, can sit cross-legged. So means we can give a wider choice in hip replacement. We can give them practically normal hip, allowing them all activities that are possible for a normal human being.
I met with an accident in Krolbagh with a bike. I had hip injury and my hip was replaced by Dr. Ashwini Mahichan. After the hip replacement, I am absolutely fine, better as previous.
If you are suffering from knee pain or hip-related problem and the specialist doctors suggest an operation, there is no reason for you to worry. At Shri Balaji Action Medical Institute, you can get this surgery done by very safe and dependable technique. The mission of this institute is to provide the best medical facilities at very nominal cost to the patients suffering from joint problems so that they are able to get rid of their pains and problems. And motion of life continues without any aches and pains so that life smiles forever.